Hey everyone, I'm Robert Mayer. I'm a physical therapist here at iPal Physical Therapy, and I wanted to talk to you about a couple of different exercises today. First exercise I wanted to talk to you guys about is the squat. And I'm going to show you how to do a squat, correct form with it, but a squat is a very important functional exercise for us to do. I know as soon as I say that word, a lot of people are just thinking, I hate working out my legs, I don't want to do this. But squats are very helpful for if you have any back pain. Because if you think about how often you stand up and sit down every day, you're doing it all day long, and that is technically a squat. So if you think about how often you stand up or sit down off of the couch, your office chair, your car, the commode, side of your bed, wherever you're at, you are doing squats all day long. So if your legs are strong enough and you have the correct form, this will absolutely help out your back to reduce any pain when you're going through any of these functional movements or any of these transitions. And then it will also just help to strengthen up your back so that you won't have any pain in the future. The muscles that are being exercised when you're doing these squats are the primary muscle is your glute muscles. And again, these are very important muscles. They're big muscles for a reason, because they should be doing the majority of the work anytime when you're standing up or sitting down. When you're walking, they give your back a lot of support. So those muscles need to be nice and strong to give your back a lot of support. Also, other muscles to be working that you're going to feel are your quad muscles in the front part of your leg. You might even feel it in your hamstrings a little bit in the back of your leg, and then in your low back as well. Any exercises we can do for the low back without any pain, it will absolutely be beneficial to help reduce or prevent any pain in the future. So remember, with this exercise, you need to have the correct form. You need to have good form so that you're using the correct muscles and you're not using incorrect muscles, which is just going to continue to perpetuate the cycle of your pain if you're using the wrong muscles. So, and I'm going to go through there and I'm going to show you some modifications that you can make. They're very easy, very simple, but that will also help to ensure that you are using the correct muscles to get the most benefit out of this exercise with as little pain as possible. So the first thing when doing this exercise, obviously, is the same old adage that you've been hearing all your life. When you're picking up anything, when you're lifting, you want to bend at your knees, bend at your hips, keep your back straight. However, one of the things that a lot of people do as they're doing a squat is when they go down, they will keep their back straight and they'll bend just a little bit at the hips, and that will throw them off balance. What I want you to think about when you're doing the squat is start to stick your rear end out back behind you just a little bit. This will help to load up the glute muscles so that they contract better. That will allow you to stand up and push your hips forward using the correct form with the correct contraction of the muscles. Now, if you can't go down all the way when your knees are just bent to 90 degrees, that's fine. I'm okay with that. In fact, that's one of the modifications that I want to tell you to make. If you can't go down all the way because you're having pain in your hips, knees, ankles, wherever, I want you to just go down just a little bit, just to the point of pain, and then back up. You do that exercise there a couple times, the muscles will get stronger and you will be able to go down into a deeper squat over time. But it may take some time for you to get there if you are not used to doing this exercise. Also, another modification that you may need to make, if you don't have very good balance, this is a good balance exercise because it's very dynamic. You may want to stand in front of a kitchen counter, a table, chair, something like that, for you just to have your hands there just in case if you need a little bit of help. Also, if you do have your hands helping you out and giving you a little bit of balance, do not push down on your hands. As we get older, one of the things that we see a lot of times is when people stand up and sit down, they tend to use their arms more than their legs, so their legs get very weak. You want to help prevent that from happening. So I want you to only use your hands for balance if you need it. If you can try to help it, don't use your hands at all. And remember, this is an interactive forum. So if you have any questions, comments, or concerns, please leave a comment below and I'll be happy to answer those.